I'm really proud to introduce our guest today, who is Dr. Michael Rabin. Michael Rabin is not only a doctor, but he is the inventor and founder of Laser Cap Company. We can see that cap flapping in the background. Whoa, that's cool. And this was formed in 2006. He collaborated with another doctor. This is Dr. David Smith. And they collaborated with a Harvard-based photomedicine expert, Dr. Michael Hamblin. And they, together with another doctor, Dr. Robert Haber, came up and innovated this light-based device for global youth and health industries. The first commercial product that was available was Laser Cap. And so we're going to talk about that in a little bit. And this is one of the first product that affects thinning of the hair, patients who are thinning of hair. And this affects up to 50% of adult women. Who knows what percentage of men? Probably higher, depending on what age we're talking about.
80%.
80%, and so it's everyone's going to have some sort of hair loss. So we're going to talk about this. So before we get started with this, what was kind of your driving force inventing Laser Cap? So what were kind of the steps that took place for you to kind of come up with Laser Cap?
Oh gosh. Well, as you see, I'm a hair loss sufferer. This is all transplant. Right in the front here, and the back's all scalp micropigmentation. I'm essentially bald. And the Laser Cap is for patients with earlier thinning hair. If the follicles are gone, you're not going to revive them. This is for underperforming follicles, and the light, the mechanism, which we'll get into, I'm sure later. It basically revs up the cellular respiration in the follicle, improves hair production. And so I did this as for the children. I did this for future generations because it was a little late for me.
And so what was your sort of what sort of took you to that part and say, hey, let's bring this onto market? How do I bring this onto market? What were some of those steps that kind of brought Laser Cap to fruition?
Well, I assembled a team. I recruited the top photomedicine guy in the country, Mike Hamblin, out of Harvard. I recruited a very good optical physicist, MIT PhD, David Smith, who happens to be a local guy in Cleveland. And then I collaborated with one of the top hair surgeons in the world, Bob Haber, who's a board-certified dermatologist, not a plastics guy, but dermatologist. They can, when they're trained, they can do transplant. And so with that collaboration, we created Laser Cap. Came out of the lab in like 2010 with the first embodiment of it, and it has the dubious distinction of being the most widely copied. I had a little trouble with the patents, but I have new stuff that they don't know what I'm doing next. It's the most widely copied technology for light-based hair regrowth in the world.
Wow, that's both a great honor, and it's also it's probably a source of frustration. They say if you can't beat them, you copy it, right?
Well, we only work with physicians, and all the copies try to go to the consumer, and it just doesn't work out. This needs to be professionally administered, so we only work with doctors.
And that kind of brings us to like another question that kind of comes up, and one of the more common questions for my patients is, here's Laser Cap, and here is something I can buy on Amazon for I don't know, a few $100s. What's the difference? Why do I need to get Laser Cap?
The big difference, and I actually created a graphic. The big difference is we're now finding in the latest research that we need much higher energy levels. Now, Laser Cap, I've done some things with the circuitry to basically overdrive the lasers and still stay within compliance. And we promote much longer treatment times. But we basically want to be way up here on the at this blue arrow on the biologic effects curve, which is probably more than 20 times the output, 20 times the energy that you're going to get from one of these Amazon devices. And so these devices out there in the consumer market are grossly underpowered.
I think the other thing that we note is that people don't understand the difference and I know the answer, but I'm going to need to explain it. It would be better for me. LED versus laser, because people oftentimes think an LED is the same thing as a laser. Clearly, it's not. So how would you describe it to one of my patients? Say, hey, I'm talking to the founder of LaserCap. What's the difference?
Well, these are lasers. Interestingly, we're finding that it perhaps LEDs at very, very high power may be equivalent to the lasers. The research may indicate that the photons from very high powered LED may be equivalent, but the LEDs that you may find in the devices, again, just grossly underpowered. And then there's a big difference in the quality of the light. It's coherent, organized light, goes in very organized waves with laser, and it's an incoherent light source. It just kind of goes all over the place. The biologic effect may be very different. It may be superior with laser, but again, the jury is still out. Although the patients, consumers cannot find LED at these very high powers in the consumer market.
And kind of going back with this kind of the foundation of this research all comes from, I think it's the late 1960s. It is some animal studies looking at basically wound heal. They originally, what were they looking for? It was 1960s.
It was a guy who was trying to, I think it was Mester. He was trying to, he was irradiating the backs of mice that he had shaven to try to induce a cancer in the skin. But this is red light, so it's non-ionizing. And he was finding these mice were growing hair. And so it's like, oh, the light bulb went off. Oh my, we're stimulating hair regrowth with this red light.
It's almost interesting that every hair growth discovery is an accident. It's like Rogaine is an accident. It was for blood pressure. Propecia is kind of an accident for prostate. And LaserCap, it's not unusual that, hey, guess what? This was an accidental discovery. So it's kind of, you see this theme with hair that all these discoveries.
Look at penicillin. There's been other medical discoveries, but hair especially. I would agree.
And that kind of leads to the next questions from patients. And I think the next question from patients, and we can answer this maybe with, kind of the satisfaction of patients doing this. A lot of patients say, does it really work? If I'm a basic science guy, I like talking about looking at studies, looking at aspect. And you look at the study in the 1960s, you see that animals are growing hair. They're actually healing wounds faster. You look in the what's hot in the world of aesthetics, and that's kind of red light versus blue light. And you see these things happening, how they affect our bodies on not just a cellular level, but almost like a subcellular level. And they ask me, does it work? And I'm obviously saying, obviously yes. But from the founder of LaserCap, your thoughts?
Well, sure. There's quite a bit of literature now. You do a PubMed search on LLLT in hair or photobiomodulation in hair, and you'll see a couple hundred research papers in the last couple of years. And so there's been quite a bit of research lately, and the double-blind placebo-controlled studies and the meta-analyses of these devices for hair regrowth all indicate we're growing hair. And the mechanism, if you talk to Hamblin, the light is used in a whole range of conditions. They're using it to treat depression, different wavelength, higher power, get into the brain. They're using it for traumatic brain injury, reduce the morbidity associated with stroke, with heart attack, any dysfunctional cellular process, any cells that have mitochondria where there's some dysfunction are going to respond favorably to the light. And Hamblin can get into. I should have brought his charts because he's got all the biochemical pathways mapped. But it's basically, it comes down to improved cellular respiration at the mitochondria. Remember the Krebs cycle from your medical school days. ATP, that's the fuel for the cell. It revs that up. So you get increased ATP production, and then a whole cascade of biochemical events that result in better functioning hairs or better functioning follicles.
And that key word that you mentioned is mitochondria, that subcellular improvement. Again, that's and anyone who's in this. So you have the doctor side, and then you have the health bloggers. And I listen to both sides of the argument, and both love mitochondria. Mitochondria has become a really hot topic, and red light and treating things is super hot. So I think it's interesting. Anytime you say, I'm going to improve your mitochondrial function, you're going to see some positives, and it's not surprising you're seeing those positives happen in something like hair.
Yeah, well, that's what we're targeting here. I mean, we're not going after facial rejuvenation. We're not trying to treat a depression or a soft tissue injury. And I've got it here. This embodiment kind of illustrates it. This kind of showcases the tech. It's red light on the head. We're going. We're targeting the follicle. This is the same technology as the shell devices. The shell, but it showcases it, so you can get a good visual of it. And we actually sell these, but they're sold at a premium.
So if you compare those two devices, that's a great topic, because that's the newest. The newest device is the shell one, right? The one on the left. I mean, that one, correct?
High tech. Yeah.
And I have the one I wear every night. By the way, I could talk to my laser cap experience. So I did a hair transplant, so I'm a hair transplant person as well. And I actually noticed with laser cap that when I started wearing the device, I felt like my hairs were growing a little faster. My other hairs were kind of going through there. And so for me, again, it's one of those things. I noticed that some of my hairs, I use trichoscopy on my head to look at them. And I noticed that some of my hairs that were kind of on the miniaturized side were actually kind of coming back a little bit. My hair is a little fluffier, and that aspect of it. So so for me, looking at the different devices out there, I looked at the data and I felt LaserCap had the the best technical hardware, the best setup. So to me, that was like there was no brainer. And if you're going to do something which is you're going to do that something it's not, I won't say time consuming, but it's part of your ritual, you better make sure it works, because if you're doing just putting LED on your head as doing nothing, what's the point? It's a waste of everyone's time.
Well, that's for sure. That's for sure. So you've got to go. Patients are always calling me directly. Hey, I want a laser cap. And I said, well, you need to go see a doctor. Well, can I get a laser cap? And I tell them, go find a hair restoration physician that you trust, that you believe in, and the rest will follow. And if that doc provides you a laser cap, so be it. If they don't, have them call me, and I'll make sure that he starts selling you a laser cap.
Yeah, it's all part of that. Now, if you compare the two different models of laser cap, so someone says, let's compare these two models. What are your thought process? So someone who's looking at laser cap, I have the older shell version. There's the newer version that's more vented. How would you? Should I switch to the vented one?
The interesting thing about the vented one, this is I work with a lot of now very high-end plastic surgeons like yourself, but historically I worked with just these pure hair transplant folks. I mean, you do all sorts of surgeries all over the body, right?
Only face and hair.
Oh, face and hair. Well, that's plenty. Historically, it's been these transplant surgeons, just these pure surgeons, and they're always asking me for, give me something more innovative, give me something high tech looking. And so it was kind of a motivation to showcase the technology and to create something that was unique. And so what we did with this, I'll show you this, how this goes. We created it's a flat manufactured device that has a front connector band that's small, medium, large, extra large. So it conformally fits. It basically hugs your head.
Oh, that's nice.
So, you just determine the patient head size and snap this thing together. I'll put it back together, and then I'll put this baby on, and you'll just see how it goes. But it's the same underlying technology. It's the same. This happens to be a 300 diode device. What I'm wearing here is a 224 diode device, but it's basically the same underlying tech. And so if we just put this thing on, you'll see how it basically hugs my head.
Oh, that's nice.
Yeah. So here, let me snap this on. Yeah. So there we go. So we're lit up. So you really don't need to cover this with a hat. You just wear it, in your home, and it's got a real, it basically hugs your head. But it's no different than I mean, this is a lot more expensive. Why? Because it's more difficult to make. I make them in lower volume. But some patients, well, I want that one. And so that's fine. But bottom line, you want to send them out with a light device, preferably a laser cap. So whichever one you use, as long as they get a laser cap.
Do you find a difference in the two different devices as far as results? So if someone said, I want the difference between this versus that, and they say, hey, guess what? I want to make sure I get the best possible result. Is there a difference? Is there a 5% difference, a 20% difference?
Again, if we go back to this curve, it hasn't been studied. It hasn't been studied. I think that all of the devices, if you look here, these are some of the over-the-counter devices. I don't really want to name names, but you can read them. I don't like to upset, competitors. Everybody's doing a good job in the industry. Your industry gets a little tricky. I mean, folks really need to look at there's hair surgeries that are being performed offshore that are troublesome. And so in our industry in the U.S., the devices are all pretty good, but these over-the-counter devices are way down on the biologic effects curve. See, that's the biologic effects curve right there. And so, one of these lower-powered ones is way down here on the curve compared to LaserCap 224. LaserCap 300 is a little higher on the curve. LaserCap 80 is still above. That's 80 diodes is still above, the best off-brand LaserCap. And that's because the best off-brand laser cap decided they're going to do a 5 or 6 minute continuous power, and they turned down they were unable to overdrive the lasers, and so that was their choice. But in my opinion, they're underpowered.
So that's something some people talk about. The way you get treated, and classically you do a 30-minute pulse every other day.
Right.
Some people talk about doing 6 minutes every day with a continuous. Let's talk about those two different protocols.
Sure.
Your thoughts on both of those and effects.
Again, a 30-minute pulse, if you look at my chart, a 30-minute pulse on a 224 is delivering about 3.23 joules per square centimeter. A 6-minute continuous with the best off-brand cap out there is doing about 1 joule. So we're getting 3 times the power with it, not because we're better, we're just, the circuit's different, and we're choosing a pulsed over a 30-minute rather than a continuous at 6.
Now, pulse versus continuous. Let's say, can the laser cap go continuous or pulse, or it always goes continuous, or it always goes pulse?
I've got a continuous protocol. Like, this is a continuous pack. I can do a continuous protocol because, again, all these devices are on the biologic effects curve. I just prefer the pulsed at 30 minutes because I want more energy per square centimeter. And that's my opinion now based on the latest research.
Do you think it penetrates deeper pulse because of kind of relaxing the cells? The melanin doesn't have a chance to block it, then it hits it. Or what are your thoughts?
There's more evidence that pulse at certain hertz, certain frequencies, is better than a continuous. There's more evidence of that, but I couldn't tell you. Pulse is better than continuous for here we go.
Yeah. And then the protocol. Why the protocol of 30 minutes every other day? Like, if I said, hey, guess what? I don't like 30 minutes every day. What I want to do is when I brush my teeth, I'm going to throw my laser cap on. I actually kind of do this sometimes. I'd say, hey, guess what? It takes me 10 minutes to brush my teeth, then wash my face and put stuff on. And I'm going to do that every day rather than doing 30 minutes every other day. Why 30 minutes every other day versus doing 15 minutes a day versus that?
It's a simple answer. The original devices that were studied were dome devices. So you'd have to go into the office and to receive your treatment. And so they had, I think, a two times a week protocol, certainly not an everyday protocol because you couldn't get in there. And then the comb device, I forget what their protocol was, but then there was some other helmet devices, the iGrow, for example, where they determined we're going to use an every other day protocol or a couple times a week protocol. And so those were the predicates that were studied with those frequencies. So nobody has studied an everyday protocol. But there's plenty of doctors who say, okay, I'm just going to tell my patient 20 minutes every day or 6 minute continuous every day, or I mean, it's all good, in my opinion.
And the reason I've done that is because if you look at some of the LED devices, not for hair, but for like kind of healing, red light for post-surgery protocols and things of that nature, lots of them you use smaller amounts of time every day. So my thought was, hey, guess what? Let's incorporate this because mitochondria is mitochondria. Let's stimulate mitochondria. Let's get more increase in our cellular activity. And so that was my thought process. But again, I have no idea whether that's a better protocol or worse protocol, but that was just kind of my variant on it. Also out of convenience. I just can't remember it. If I do something every day, I remember it. If I do something every other day, I forget. Because if I work out every day, I'm good. If I work out every other day, I'll forget and I won't do it.
Well, these are physician devices. These are by physician only, and the physicians can do whatever protocols they want. I mean, the light is generally safe. I mean, you can tell your patient wear it till the battery runs out. Wear it for 2 hours. Theoretically, there can be an overtreatment. It's biphasic. There can be an overtreatment. 10 hours, 20 hours. We don't know, and it's theoretical. I think at these powers. It's still a low power, even though it's 5 milliwatt, even up to 50, even up to 500 milliwatt per square centimeter. It's still considered low power. You're not cooking anything. You're not killing anything.
Okay. And so is someone who's trying it to say, I'm going to put a laser cap on, what is the amount of time before you say, hey, guess what? You're going to see something different. And what are your thoughts?
Well, I think that you ought to give patients 4 to 6 months. I think you ought to give them 4 to 6 months before you bring them back. I mean, we have a 1-year return policy where patients, anytime in the first year can bring it back for any reason, no reason at all, to the physician. Then the physician will refund 75% of the purchase price, and then we work it out with the doctor. But yeah, I would give it a good 4 to 6 months before you bring the patient back for some repeat photography, and even a whole year to because growing hair it's a slow business.
And I think that's kind of speaks to me the quality of laser cap in the sense why one of the things I'm a believer in laser cap is because anytime you have a company that believes in its product and says, hey, guess what? If you don't believe in it as a patient, we're going to work with you. And anytime I've not gone quality with something, whether it's a vitamin, it's a healthcare equipment, it's a car, when you buy a quality product, you have quality, you have the best item. And you just feel good about it because whatever reason, you feel like you're covered your back. Versus if you buy an inferior product, you're like, well, it didn't work. Well, you're using the wrong thing. Something happened to this product. You're covered. You're in good hands. Your power output's going to be consistent. You're not worried about, getting 10 joules and 1 joules. And I see that with a lot of my lasers in the office that some of the older times you would get different things that were tweaked. And now the newer lasers are not doing that. But I'm imagining it's something like a laser cap that you might have some of the other products that peak out and then go down. Is that?
I think there's trouble with some of the manufacturing with some of the devices. I mean, there's some very good off-brand laser caps that are manufactured, but then there's a lot of copies where, I think that I don't think there's any safety issues, although, there can be battery safety issues because, it's a lithium battery. But I think you get problems with lights out and just defects, just issues that we handle. We have a lifetime warranty policy on the devices, so it's covered for life. We have a small replacement fee between 3 and 5 years, and then a slight no replacement fee in the first 3 years. Small one, $250 in 3 to 5 years, and then $500 after 5 years.
I mean, that's an amazing product, coverage of something, and it speaks to it again. A couple other questions. So with laser cap, do you notice? I mean, you have a lot of physicians who use this and believe in this product. Do you notice any sort of protocols that people are doing that say, hey, guess what? This works well with laser cap. Is it like, hey, guess what? Laser cap and Rogaine, laser cap and PRP, laser cap and
it is synergistic with all the hair regrowth. In hair regrowth, you don't You don't want to do experiments on your patients. You don't want to. I mean, some docs will say, "Well, let me start you on laser cap, and then I'm going to add the Rogaine or the topical finasteride or this or that." But really, you want to just come out of the gate, and these patients want hair regrowth. They don't want experiments.
Exactly.
And they all by different mechanisms. The finasteride is the DHT blocker, the minoxidil is in calcium channel, the light is improved cellular respiration at the mitochondria. The PRP is, in that regenerative genre. We're at the tip of the iceberg with that because with the PRP they're adding STEM and all sorts of ECM stimulants and activating the platelets, and there's a whole slew of things. Light is synergistic, I believe, with all of it. It's additive and can be synergistic. So, for example, laser cap plus minoxidil. So when you put this on, if you put your minoxidil product on, and you put, even though the manual says, "Oh, well, don't use it on wet hair."
Should you put minoxidil on first, or your
well,
laser
put
cap
it on first. Put it on first, and then put the cap on. You get some warmth. You get an occlusive effect. You get a big bump in absorption of whatever you put on.
That's a great tip because I've actually been doing that the other way. I've been doing the cap, then the minoxidil. So I should actually switch that around. So that's a nice thing.
Patients that may get a systemic effect, so you got to be careful. I mean, not that I've documented that, but you're going to get an increased absorption. The dermatologists did the Vaseline studies and the Saran wrap studies. Where they put the topical on and then put the syringe on, and big bump in absorption. And it's a similar effect with the occlusion. All right, and then there could be some direct effects with the light. You increase circulation. Nitric oxide formation, these things may be contributing to the effect of the minoxidil. We haven't studied it, but the sense is that it's a good idea. There's real synergy. And then PRP, that's a whole other issue. PRP always should be followed with laser cap, always should be followed with photomedicine, because there's similar processes going on. The PRP, the growth factors, are supposed to stimulate endogenous stem to recruit the endogenous stem to improve the follicle function. The light does a similar thing, but it's ongoing. After the PRP is done.
You have a new laboratory, a new scientific research part about laser cap, which I think is also exciting. That I don't think there's any other company who's doing that.
To do that.
Can you tell me like some of the things that at least that you're able to talk about that's going on over there, and some of the things that you're discovering with this new arm of laser cap?
So we're trying to put together a PRP plus photomedicine for hair regrowth registry trial, and the idea is that we work with doctors. We look at their PRP. What's the cellular makeup of their PRP? Are they using 1 times platelet, 2 times, 4 times, 8 times? Are they using, what protocol are they activating? Are they using additives, etc.? And then with or without PhotoMed, we encourage all the docs to use the PhotoMed. But the idea is that we try to correlate PRP. We try to characterize the PRP and correlate it with hair regrowth outcomes. So we also ask them for baseline. We will ask them for baseline photography, trichograms, whatever they're using to measure the baseline and the progress, and see if we can draw some correlations between, PRP characterization, use of PhotoMed, and we have a PhotoMed optics lab set up too to measure outputs. So if they say, "Oh, we're using a Theradome, or we're using this off-brand or that off-brand," well, we know what those outputs are. We know what the energies are per square centimeter on those devices. And so we again are looking to try to correlate these treatments with hair regrowth effects.
And I think that's such an important part, because with PRP itself, there's so many versions of it that are out, and it does a disservice to PRP, because there's people who are getting PRP that's actually probably not even has that much higher platelets than normal, and yet people have 2 times, 3 times that are actually getting improvement in their hair results. And we've tried previous protocols of PRP in the past that have not been as effective as some of our ones we're using right now. So I think that's an exciting part, to see that science kind of and hair kind of going together, and you're seeing these synergies working across fields, which is, I think, amazing for the field.
Yeah, I want to document that because there's a lot of anecdotal. You've had experiences, your colleagues have had experiences where they start with one kit, they start with one protocol, and they don't like it for whatever reason. There could be some pain, there could be some bruising, not good results, and then they switch to another protocol and they're getting results. So we like to formalize that.
What's the craziest hat you've seen over a laser cap that someone's covered it with? Or what's the craziest activity you've seen someone do?
Oh, well, I would always jog with mine back, when I pre-transplant, when I was trying to grow my hair. I would always jog with mine. So that was always fun. I'd put my minoxidil on, put my cap on, and I did pretty well with it. But I ended up with doing major transplant just because I just didn't have any hair.
And then the other question on that, so you basically any hat on that. Do you think there's an issue with heat if you wear like a winter hat over it, or probably has no effect on it?
Well, the laser cap generates some warmth. Some of the consumer devices don't generate much warmth, but they're not putting out any power. So the laser cap generates some warmth, so it's advisable to wear not wear a heavy hat. Yeah.
Okay, cool. And then people sometimes always ask the question, am I going to get more of a result with short hair versus long hair, or do you think there's no difference?
Well, hair will block light, but we put out a lot of light with these devices, and that's number one. Number two, you're using the cap because we can see a lot of your scalp. And so if we can see a lot of your scalp, there's lots of photons getting to and through your scalp. On the other hand, if you've got thick, dark, opaque hair, you're not as there's going to be some block, but some light blockage. Now, ways to mitigate that. Again, the manual says, hey, don't wet your hair, don't use it on wet hair, but it's okay. You can do that. This is moisture sealed. So patients if they got long, they got thick hair, they can wet it, comb it back, expose maximum scalp, put their minoxidil on, whatever they want to do, and with the doctor's permission, and put the laser cap on.
So the only thing, so what is the restriction with laser cap? So people talk about that a lot. Is there basically don't wear it in the rain, is my understanding, and don't shower with it, obviously.
Yeah, I mean, it's low voltage. You're not going to electrocute yourself, but you don't really want to wear it in the bathtub per se. I think really the only contraindication is if you've got a neoplasm that's being directly, a cancer on your scalp, a basal or a squamous cell or whatever it is, and you're directly irradiating that. You're photostimulating not only your follicles but a neoplasm, and so you could rev up. I mean, it's not a crisis because those are slow growing, but then you always have to worry about melanoma. If you've got, and that's your job as a doc. You need to look patients over.
Absolutely. It's one of the areas that's oftentimes missed is scalp melanoma. It's one of the bad spots that melanoma can exist. The back, the scalp are two areas that patients oftentimes melanoma is missed.
You got the hair covering it.
But most of my patients who are wearing the laser cap, like you're talking about, the hair obstructing it is not as much of an issue. Again, I don't think I have so much see-through, but I do have some see-through. So
you got a little, but you got a lot of hair. I would advise you, wet it and put the minoxidil on.
I'll probably change that protocol. I'll put that on there. That's a great tip. So keep your hair wet, put the minoxidil on, put the cap on. I still probably will do my brushing teeth protocol that I do at night, just because otherwise, if I don't do everything every day, I forget.
And that's better for the minoxidil because minoxidil is an everyday sort of thing. It's supposed to be twice a day, but you could do it once a day. If you do it my way, you just do it once, you'll be fine.
So where do you see laser cap in 5 years, 10 years, anywhere where you say, hey, guess what? This is going to go, is laser cap going to stay here? Is it going to go other spots, or is it going to be different power outputs? Where do you see the product going?
We're going to increase the power and the energy. And I've got some technology some promising technology that this time I might get the patents right. Who knows? Protect all the doctors out there. So yeah, I think we want to see more power. We set up a cell lab, a PRP cell lab. We're also setting up a wet lab to do some bench studies on hair follicles in the petri dish, in the culture dish, so we can directly irradiate them and take certain measurements. Emulsify the dermal papilla and measure growth factors and look for changes. So that wet lab is going to give us some good information to try to zero in on if I go back to that biphasic dose response curve, should we be here or should we be over here or should we be there? We want to kind of try to zero in on optimal power and time. And then wavelength, yeah, there's a little debate, but most of these are red light, 650, 660 nanometer. There's some thought maybe we should look at infrared, but the bench work lately is showing that the red at 660 seems to be working the best. So why change?
Exactly. And so for power, for again, consumers looking at different models, it's not just the number of diodes. It's not just the power. It's not just the area. It's not just continuous versus pulse. It's kind of like all of that makes everything better. Is that true?
You need diodes because you want to get some coverage. You don't want to have, you don't want to just have a few diodes across a large area, because then there's a lot of follicles that aren't getting much light. So you want to get some uniformity, which means you need, more diodes. But then it's what those diodes are putting out. It's the power, it's the milliwatts that they're putting out, and then the time period, because milliwatts times time, that's the joules, that's the energy, and then per centimeter is really the ultimate measurement. The energy per square centimeter in joules.
Perfect. Okay, so last question I always ask everyone is, what are, just in general for the kind of off-topic things, what are 3 things you wish to see different in just, I say healthcare or healthiness or any of those things? It doesn't have to be related to hair. It can be related to hair. It can involve anything. So 3 things, you can make it 2 things, but what are 3 things you would love to see changed in that aspect?
Well, I think that first off, I think you guys are doing some incredible work. The plastic surgeons and the transplant guys and gals are doing miracles with patients. And medically, we're there to support and to slow the loss, stop the loss, reverse it. We're there to help. But the surgery you folks do is incredible. I'd say that. So don't do much different other than just keep improving what you're doing. On the inside, the medicines that we take, the diseases that we get, the heart disease, the Alzheimer's. I think it's all preventable. I think it's all. I think we can live to a ripe old age and then drop dead. That's what I think. And I think we've got tremendous environmental toxins, the food that we eat, the air that we breathe, everything around us. There's all sorts of toxins and pollutants. But there may be some ways to mitigate that, to manage that. The diet can change, and the medicines that we take. I've been turned on recently to orthomolecular medicine. I know that is probably not something that resonates with you, but the anti-aging doctors who are on the cutting edge of things, who are doing intravenous vitamins and doing chelations, and I really think they're onto something. And I think light can play a big role in that as well, in keeping patients healthy.
Actually, the anti-aging part that you talk about is actually super fascinating for us, because with hair, we don't just use one modality. I mean, we always want to be on the cutting edge. So things that we're using in the office include not just PRP, but things like exosomes, which are messengers sent back and forth with the cells, as you know. Also working with a bunch of the things, growth factors. So kind of all of these things stimulating hair, all kind of working together. And it's interesting also you mentioned environmental toxins, because all of these things, environmental food toxins, affect our mitochondria. And with the laser cap, one of the things you're going to do is you're going to be stimulating your mitochondria to improve that. So they all kind of work together. So get rid of those toxins so your mitochondria can work better, but also stimulate them. And then, so all of that's working together. I think amazing what you've done, amazing what you've accomplished.
Okay.
And imitation is the best form of flattery. Although if I had a company where people were copying me and sort of ripping off my product, I don't know if I think that way. But and I think there's probably more doctors who need to personally thank you. I'll thank you in person. Thank you for all that you've done for the science of lasers in hair. Thank you for my patient. Thank you for myself because I use it.
You are welcome, and keep growing, keep buying caps and growing hair.
There we go. I want my hair next time I talk to you. I want it to be this big.
Your hair looks awesome. Your hair looks awesome.